everyone, and welcome to the Voice of Pancreatic Cancer podcast. I'm Miranda Weinberg with the Seena Magowitz Foundation.
I'm Susan Tsai. I'm a surgical oncologist at the Medical College of Wisconsin. Thanks for joining us on these monthly podcasts. We're really excited today to have Kersting join us. She is a licensed clinical psychologist who provides counseling and psychotherapy to patients that are treated here at the Medical College of Wisconsin, specifically in the Surgical Oncology Division, and she works very closely with our pancreas cancer patients. Just a little bit about Dr. Kersting. She completed her undergraduate degree in journalism at University of Wisconsin-Madison, and then went on to receive a PhD in counseling psychology at VCU, Virginia Commonwealth University in Richmond. And then she also did postdoctoral fellowships in clinical health psychology at the VA, kind of a place near and dear to my heart, in Dayton, Ohio. And she's joined us in 2016. So we're very excited to have her join us today.
Thanks. Thank you so much for being here with us, Dr. Kersting. And if you don't know about the Seena Magowitz Foundation, just a quick introduction. We're a nonprofit that's committed to the awareness, prevention, and cure of pancreatic cancer. So thank you, ladies, for being here. Dr. Kersting, I think we could start with you. Maybe you can introduce yourself a little bit more, talk about your background, and what brought you to where you are today.
Sure. So like Dr. Tsai said, I started out in journalism, and that was kind of my first career. And then I got interested in counseling and some of the helping professions. I actually worked as a writer, writing about psychology for a while before I went to grad school. And then I did a PhD specifically in counseling psychology with an emphasis on health psych. And then additional training in behavioral health management, and interestingly, integrated primary care is kind of where I started. And that's a practice that puts psychologists in with primary care doctors. And that was really great training to work with a lot of health providers to get me set to work with pancreas patients and all of their providers in a multidisciplinary sense.
And for someone who's never seen a therapist, can you maybe walk us through what happens during the first session when you're meeting folks?
Sure. This is a great question. I really like answering this one because I want people to know that it is not as intense as the thing you saw on TV last week. It's just not. So when I bring patients in, I first start with getting some background information about them. And at this point in their process, they've probably given their background information half a dozen times to different kinds of providers. But my lens is a real focus on who are the people in their lives that are supportive of them, how they've been coping so far, what they've done in the past to cope, and additionally, what they enjoy doing, what makes their life good, what makes them happy. So I'll start with a bunch of questions like that. I also like to know about people's relationships, who they live with, who they feel best with, the people in their lives. And then I'll, ask some questions about their mood. Are you feeling down regularly? Are you worried regularly? How is that impacting things like sleep and eating? To kind of find out how all of that is working. And then we'll work together to identify the issues that could use some tweaking or some specific support around managing anxiety or depression symptoms.
So in that capacity, I think some analogies that I see are almost like, like a coach, basically, that, in some ways you hear about executive coaching and athletic coaching, and maybe this is maybe healthcare coaching.
Absolutely. Absolutely. And if you think about it, moving towards surgery, you're about to face one of the most difficult things you'll ever go through. And so it makes perfect sense that you should have additional support, regardless of whether you have anxiety or depression problems, regardless of whether you've had perfect mental health your whole life. You're headed towards something difficult. And that merits a conversation about how you're going to get through it as best as you can. So we can call that coaching. We can call it a number of different things, but I think it's important for everyone to have that kind of opportunity.
And what would you say to maybe a family member that wants to encourage their loved one to reach out for something like that? Maybe they're more hesitant. It's such a touchy subject. And
it is touchy. Yeah. And there's still a lot of stigma out there, especially for people who've maybe never talked with a therapist. So family members can help in a lot of ways. I think one of the most important is talking about their own experiences with mental health treatment. If you've had a positive experience, it's really important to go into detail about why it was positive for you and talk to your family member. I think that goes a long way. Also, just acknowledging that they're going through something very, very difficult and they deserve to have support. And another piece is if people are struggling with specific problems like sleep or eating, panic attacks, even pain, those can be reasons to come see a therapist that don't lean on ideas around mental illness. So those can be a great opportunity to get started with someone like me to work on a specific issue like sleep and then venture into other areas where I can be supportive.
Yeah, I think that's a really great point, Karen, because I feel like there's some hesitancy because oftentimes people think of maybe seeing a psychologist as associated with mental illness, but it certainly is not. And so, I think a lot of people would say, isn't it normal to feel kind of sad and scared, in this situation? Wouldn't everyone feel that way? And why should I see a therapist? But I think you're giving a different perspective to that.
Yeah, absolutely. And you bring up a great point. The system is set up so I do not need to find depression or anxiety. I don't need to diagnose you with depression or even an adjustment disorder to have you be able to see me. And you're right. It makes sense to feel sad and scared and worried. So I take all of that into account when I'm working with patients. Now, if you're experiencing the kind of worry that keeps you up all night, that prevents you from being able to enjoy time with your family members, then that might be something that we would work on specifically. But you're right. Everybody is going through a difficult time when they're diagnosed with pancreas cancer. And I meet them where they're at on whatever issues they want to work on, including just getting ready for the long haul.
And Karen, I think you and I have talked about this briefly in the past, but we've been focusing a lot about the patient's support. I think sometimes the caregivers often require, I think, some help as well. So maybe could you speak a little bit about that for caregivers? Should they also see a health psychologist, or what are your thoughts there?
Yeah, I don't necessarily. I think the caregivers don't necessarily need to see a health psychologist specifically, but a counselor or a therapist. And when I say that, the 3 degrees that are good to look for are licensed professional counselor, masters of social work, or a PhD or PsyD in psychology. So you're looking for a psychologist, a licensed professional counselor, or a social worker. And so I do think it's important for caregivers to seek that kind of support. And the tricky thing is often caregivers feel like they're not the one in pain, that they're constantly worried about the patient and not worried about themselves. So it can be a difficult hurdle to get to the point where they see that they deserve help as well, that this is also something help happening to the caregiver. So I think those are really important conversations for the caregivers to have with their family members and even the patient themselves to be able to spot when someone's struggling around them and encourage them to seek help or just take time or remember to do the things that help them feel well. There's a lot of strategies to managing caregiver burden, and it's useful for everybody in the family system to be thinking about that.
So it sounds like, just to recap, that if caregivers choose to seek out help, it maybe is not a co-counseling kind of setup. It's more of a separate environment.
Absolutely. And for example, in my work, I can only see patients who are patients at the cancer center. So, and it is important for caregivers to have their own therapist and to be able to specifically work on their own issues. If there's actual marital conflict, then couples counseling could be appropriate, but that's not for necessarily this caregiver stress. Yeah. You would start with your own individual therapy rather than doing family therapy. Good question.
Great.
And what about insurance? I know you mentioned it. Is this something that's usually covered by most insurance agencies, or do you find that a lot of times people have to pay out of pocket?
Yeah, it's usually covered at this point. And there can be sometimes limits on the number of sessions, but it is, I rarely find any problem with insurance coverage. And honestly, if you've got all the expenses of a cancer treatment, the cost of therapy for the insurance provider is very minimal compared to everything else you're going through. So I don't, and it makes sense to everyone that having therapy when you're going through this process is important. And I should say in particular, you don't even need a mental health diagnosis to get work with a psychologist. If I'm working on, for example, an issue around, eating or any of the behavioral issues that I mentioned before, the billing takes place under the diagnosis of your cancer itself. You don't need a mental illness diagnosis to have an insurance provider, insurance carrier pay for this.
That's good to know. Well, is there anything that we missed? Anything that you wanted to add?
No, great questions. And I really appreciate the opportunity to talk about what this is actually like, to dispel some of the stigma around mental health treatment, and just to talk about this amazing opportunity, this amazing job that I have that I love so much.
Karen, thanks for all that you do for us.
It's great to be here.
So lucky to have you.
Thanks so much, Susan.
And yeah, thank you for joining us. Hopefully we'll be able to have you again sometime.
I would love to. Yeah.